Please go ahead.
Yes, good afternoon. I'm calling from Laval, Quebec. It's the outskirts of Montreal. And our previous caller was mentioning if there were any other symptoms besides the hands and the feet. And I experience in the upper thighs, and on my feet was in my toes, but it's been decreasing. However, there's a lot of feet cramping and leg cramping. And my second question would be dizziness. Could it be confused with balance? Because I've been feeling quite dizzy lately, and I'm just wondering if it could have anything to do with my chemo that I've received. I had my last chemo treatment in January. And that was my main question about the dizziness. And as far as the TENS is concerned, I've been to the physiotherapist, and they don't suggest TENS once you've had chemo. Now, it's a bit confusing because you were mentioning also the TENS. And for the pharmacist, regarding calcium and magnesium, I am taking that right now. I started taking one at night because I have difficulty sleeping. Could that help? And thank you very, very much. I've enjoyed this conference and looking forward to a next one. And if I could make a suggestion, I heard the two other subjects, but would it be possible at one point in time to talk about how we feel after the cancer? We receive our last treatment, and then we go home and we see the doctor every 3 months, but in between time there's worries and we're scared, and having a second time ovarian cancer, often we hear about, read about it, and I would like to be able to assist such a conference and see how other women feel. Unfortunately, right now I don't have a computer, so this is the only way I can converse with the people.
That's a terrific idea, and we'll certainly take note of that. Thank you so much for that idea.
Thank you.
I'll start with the last question in terms of the calcium magnesium that you're taking by mouth. The evidence that calcium magnesium might affect the outcome really comes from giving the drugs intravenously. If you're taking the calcium magnesium for osteoporosis or for good bone health, I would encourage you to continue that. I would not stop it. Again, the evidence is only when the drugs were being given intravenously and at bigger doses than you would take by mouth.
I had forgotten to mention, I'm very confused about all these numbness and tingling and all that, because I also have fibromyalgia, so that doesn't help.
It's going to be Dr. Dawson, it's going to be very hard for you sometimes to figure out which symptom is because of which underlying problem. I will say that I've never had somebody come in with a main complaint of dizziness. Typically what I find is the person feels like their head and their main part of their body is stable, but they just don't know where their arms and their legs are, or that they're a little bit off balance, but they don't feel like the lack of balance is in their head. It's more that their limbs are a little bit out of sync. I don't know how Kathy feels about that, but I'd wonder if the dizziness is related to that.
Well, I don't have lack of balance as such. It's just that lightheaded, like, as if I have to pick myself up, somebody's pressing on my head type of thing. And that happens like in the morning, the latter part of the morning. It starts like that. I have gone, mind you, between parentheses, I have gone for blood tests, so we'll look into that too, because I missed a lot of iron after my chemo. I had iron injections for a while because the level of the hemoglobins was very low.
We haven't used TENS here on anybody that I can think of. I don't know if Dr. Dawson can think of anybody. I've certainly seen it used for neuropathies in other settings.
Because the physiotherapist, I mentioned that because I had read about it. And they said that once you've had, with chemo, they don't, because they ask us all sorts of questions about our system and all. And once I mentioned chemo, they said we don't suggest any kind of TENS or any other kinds of apparel directly to the body.
Okay, because certainly there are some studies that have used that have found it to be helpful. I'll certainly check with our physiotherapist here. I know that sometimes you'll read things that say don't use massage because if you have metastasis,
Exactly.
it causes it to spread and all those sorts of things. But we certainly would encourage our patients to use that if it was helpful, depending on the individual person and their particular situation.
Oh, because you early on with someone that was asking a question, they were mentioning the TENS, and maybe I misunderstood. I thought you were suggesting to take the TENS.
Yeah, some of the research has shown that TENS is helpful, so I'm not really sure what the reasoning is for the physiotherapist saying they wouldn't use it in patients who've had chemotherapy.
Well, next time you might have some information.
I'll call our physiotherapy department here and there and just ask them that.
Well, I thank you very, very much.
It may well be like massage where the person giving the treatment just wants a letter from your doctor saying that your doctor thinks it's okay. I know very often massage therapists won't treat somebody until they get a letter from us saying, please go ahead.
Okay.
Personally, I think massage is perfectly safe in people who've had cancer.
Okay. This tingling and this numbness, does it eventually, on some people, because I was hearing the poor lady there 14 years, but because I find it decreased in my toes, definitely. Then the cramping happened in my feet and in my legs, but the numbness in my toes, does it eventually go away?
It depends on the individual. For some people, it will totally go away. And for some people, it will not go away. They will get some improvement, but not go completely away. And some people will be left, as the other speaker was saying, that they still have severe neuropathy after.
All right.
Very individual.
Life is hope, so we'll hope.
Yeah.
Thank you very much.
Thank you so much.